You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. Okay, I can officially say that this is the longest it's ever taken me to nail down an interview. I have been talking with Jessica Dorrington for easily a year and a half, and finally, we are going to make this happen today. So
Yes.
I'm so excited to have physical therapist, mom, runner extraordinaire, runner to the stars, or PT to the stars, Jessica Dorrington on the podcast. Jessica, welcome finally to the show.
Yes, we finally get to make this happen, and I'm so excited for the rich conversation we're going to have.
So good. All right. So for people who have no idea who they are and they have no idea what joy and fun is about to occur, tell us a little bit about who you are, where you're from, what you do.
Great. I'm a physical therapist that has been working for about 2 decades, both in the orthopedic hat and in physical therapy for the pelvic floor. So I took a background of orthopedic knowledge first, and I have a huge love for running as I'm a runner myself, and combined all 3 of those spaces of sports med, pelvic health, and orthopedics. And I'm a director of a clinic out in Portland. We have 15 PTs at our clinic. Half of those are pelvic floor therapists, so that tells you the need of PT out in the world. And yeah, I'm a mom of 2 sons and avid marathoner.
Yay, just a few things. And then how did you, because you ran in college, yes?
Yeah, I ran high school and collegiately, cross country and track.
Yay.
And then running took a back seat while, you're working on your profession, and finally kicked it back up about 4 or 5 years ago and said, I'm going to put my own health first and see what can happen if we actually put into play what we teach our patients to do. And I think working with all the pro and Olympic athletes, they inspired me each day. And so I got back out and started competing on the marathon scene.
Yeah, and you've been kind of killing it, by the way. She's being modest.
I'm enjoying the ride. I'm running faster than I was in high school and college, which I think just has to say, like, if you put in the work and you do the strength training and the plyometrics and all the things that we know we need to do, both for our menopause and post-menopause kind of training, as well as what we're teaching our patients to do, you really can do a pretty amazing thing. So I'm going to keep riding the wave until those PRs kind of lose themselves, and then figure out what's next.
Totally. So you were one of those PT students that said, I want to go to PT school because I love running and I want to work with runners. When did the shift finally happen where the orthopedic mashup came with the pelvic health mashup, and then you're like, wait, these shouldn't be separate, they should be mashed
together
up.
Yeah. Well, I fell into pelvic. If you would ask my PT classmates, they'd say Jess is the last person to ever do pelvic health. And there were a couple of people in our class who were like, this is what I know I want to do. And my first job out, my first year as a PT, they said, will you take over the pelvic floor program? And I was like, I will only teach at that time Kegels, right? That's all I'm doing. And you started to realize how much better it made people's lives. You realize the impact it had both on their intimacy, on being able to go places, on being able to run and do activities without leakage. And you saw the bigger picture of it. So I always kept that as part of my hat. And then the need was just so strong that all of a sudden that became my caseload. And I'll never forget, I reached out to my mentor. I said, I don't know, my caseload's getting so big in pelvic. And he was my orthopedic mentor, and he goes, Jess, it's still orthopedics.
Right.
The pelvis is still orthopedics. You still have to do all your ligament testing. You still have to know all your muscle functions. You have to know your biomechanics.
Yep.
And at that point in time, I was like, aha, yes, I can do both these worlds. And then combine everything. So
yeah, no, I fell into it in a very similar way, got hired to do pelvic health, and it was very separate from orthopedics. And then one day you're just like, well, why don't I put it all together? Which again, sounds so ridiculous today, but was so novel
Yep.
back in the day.
Yep.
And again, back then we weren't really, because you and I are similar vintage, we
Yep.
weren't really treating a lot of everyday runners because that wasn't necessarily as common as it is today. And that
Yeah.
wasn't like that long ago. We're not that old. I mean, when
Yeah.
did you start? Did you start to see the shift more kind of working with athletes, more specifically with like semi-pro or pro athletes,
Mhm.
and then more the everyday runner, or was it vice
You
versa
know,
or about the same?
I would say, part of it was just whenever someone would come in, you'd be like, what do you love to do? What do you want to
Yeah,
get back to doing? And so for, your regular clientele, I felt like that was always our end goal is, can you get
right.
someone back to running and how do you get there? And I just always have looked through that orthopedic lens. Even when I sit in a PT class, or continuing education, I'm always thinking like, how does this fit with the orthopedics
Yep.
and what we know to be true from a clinical reasoning standpoint. But from the pro athlete standpoint, most of them, I started seeing them prior to having babies. For many of them,
Mm,
knew their bodies really, really well. And then you start to go through the process of, okay, the Olympics are done or worlds are done, and it's time to think about kind of creating space and expanding their family. So there was a lot of that where it was just naturally integrated, I think.
yeah, and you're also in such a great part of the country to work with runners, period.
Yeah. Yeah.
Like, not for
Yeah.
nothing.
Yeah, we're really fortunate out in Portland. It's obviously the hub of Nike and Adidas and Under Armour. They're all out here in Portland, Oregon. So it's definitely a great place and great venue for that.
Just a few famous faces walking around.
Yeah. Although most people have moved to altitude and
Yeah,
moved higher up. So that's been definitely a shift in the last 4 or 5 years for the pro and Olympic athletes for sure.
yeah, for sure. So if you had to like describe the journey of an everyday, postpartum runner,
Yeah.
getting them back versus a high level athlete, what are the key differences and what are the key
Mhm.
similarities that you have found?
It's funny. I'm actually writing a book right now with Shannon Robury. It's called Strong as a Mother. Like the reference of that. But it's all about how to get back. And what that does is that starts during pregnancy, right? We know that if you exercise during pregnancy, you're twice as likely to get back to the activities you love to do postpartum. And when patients would come in postpartum, I'm like, oh, I wish I could have seen you beforehand,
Yeah.
right? Because I could have taught you all these things along the way and we'd be setting you up for success postpartum. But with working with so many pro athletes and working with regular recreational athletes, you realize it's very similar. It's so similar because we've seen athletes who will take a really high approach. I've seen athletes who, ran 100 miles a week, even still while they were pregnant, came into our office, had some issues. You saw people who really stepped back, and everybody kind of settles in the middle. And settling in that middle is for most people, reducing the frequency, reducing the intensity and duration, but staying in a place where we know we can get our heart rate up still and still do the strengthening and do the abdominal and core work that we need. So it's really probably more parallel than not.
Yeah, no, I think that's the funniest thing when you go kind of look at the evolution of research is we
Mm-hmm.
do have these separate paths that have to occur, but there's so many, between the everyday, person and the
Yeah.
the high level athlete, but there are those similarities. But you
Yeah.
mentioned before we hopped on, one of the things about pro athletes is you have to watch your dosing and watch your words.
Yeah. Yeah, I said being a PT for high level athletes is very humbling because you decide clinical reasoning. You're like, okay, I think X, Y, and Z are contributing, and I'm going to give you these 3 exercises, and they'll do them 100 times. And if they come back and things aren't different, well that your dosing and your clinical reasoning maybe weren't the best, and you have to take a different path. So definitely
we
humbling in that way.
we get that here in DC, not because we have a lot of pro athletes, but we have a lot of very driven people, and we have to be very
Yeah.
clear. Love you, patience, but you know what I'm
Yep.
talking about.
I used to work in a different part of town and I would dose twice as much because a few of the patients wouldn't do the exercises And now my clinic is very close to Nike and Intel,
Mm-hmm.
and the population tend to overdo the exercises. So when I first moved out here, all of a sudden patients were like, oh, I already did my exercises twice before I came in today. I was like, oh
Right.
goodness, I only told you to do those twice a week.
Right. You're like, oh, forgot where I was. Not in Kansas
Yeah,
anymore.
not in Kansas.
Yeah.
But I would say the one difference when you're looking at postpartum for athletes versus a recreational athlete is really the drive to getting back. And
Mm-hmm.
that I think is a different
Yeah.
different piece. I think number one, because their strength coach and their coaches get involved, and sometimes you can't manage the dosing. And sometimes they sign up for races or they run more than you want them to, because either A, they have personal goals, or B, they have contracts, which contracts have changed now, but they used to have to run to keep their contracts so that they
Right.
wouldn't get reductions. And, you know, those different stressors, when the system isn't ready for it, we do see that a lot of those athletes were having issues if they were coming back too quickly, and some of that beyond their control. So,
Yeah. No, I would think
yeah.
that would be a big challenge. I have a bunch of friends who work for some pro sports teams, and I mean,
Yeah.
navigating those interrelationships and the
Mm-hmm.
hierarchy and all that kind of stuff sounds quite
Yeah.
challenging. How has that changed, as far as respect for
Yeah.
you? Because I feel like PT has a role, but then
Yeah.
you're kind of in this weird, almost like untouchable sort of space where they're like, oh, you know about those things that people don't want to talk about. Like how has that evolved?
Yeah. You know, I think early on, I mean, several of my athletes, the coaches called me up and said, hey, you know, what do we do? How much dosage should we have? They really respected that kind of knowledge that we bring to the table, and just kind of said, here you go. On the flip side, there are also, I think, were times where coaches are like, you hit that 12 weeks postpartum, where we kind of in our society have kind of tagged 12 weeks as, oh, maybe you can get back, and coaches start to take over more, or athletes programs start to progress. And I think that's where a little bit of it gets lost. If I had
Mm.
a magic wand, I'd be able to follow somebody, you know, all the way through a year or 2 years,
Oh
because we
yeah.
know that that takes that long, but insurance wise sometimes that's not always feasible.
Yeah. Do you
Yeah.
find that athletes are coming to find you like you're like the third person to find out they're pregnant? Or I know I am sometimes. It's like the doctor knows, the spouse knows, and then you know.
Yeah, I was gonna say, or even sometimes just them and their spouse, so that I'm the next phone
Hmm.
call,
Yep.
which is pretty fun to be able to navigate. But it really has allowed us to see what happens when you do implement all the important factors that we know that we really want to be able to add into a program really early on. And, you know, oftentimes patients won't come in until either there's a pain,
Right.
maybe, you know, second or third trimester they're coming in, and then you want to give them all this knowledge about strength training and what they should be doing for cardiovascular fitness during this time frame. So it's been fun that way to be able to implement everything early on,
Yeah.
as I'm sure you probably see too.
It's I mean, again, we're a little high achieving here in DC, and so I
Yeah.
have that will reach out while they're trying to get pregnant,
Yeah.
because, we wanna check those boxes over here, which is great, I love it.
Yeah. Yeah.
But again, like, it just allows you to have a lot more opportunities for
Mhm.
conversations to answer questions rather than, like, somebody screeching in at, like, 38 weeks and be
Yeah.
like, "Tell me everything."
Yep.
But again, I feel like we're in such a and we kinda talked about this briefly before we hopped on, was like, we're in such a different place
Yeah.
now as far as the advice that we can give, the recommendations that we have.
Totally.
Whereas, like, when we came out of school, like, you were early 2000s, I was
Yeah.
99, like, we didn't really have anything to
Yeah.
say, we're like, "Stay active," but, like, we didn't really know what that meant. I mean, what
Yeah.
does that evolution look like for you as a professional? And then also, because your kids are how old?
Yeah. 10 and 14.
Oh, yeah, so we're similar.
Yeah.
I have 11
Yeah.
11 and 13.
Yeah.
Yeah, so I mean, you experienced this very differently.
Yeah.
Kind of what does that evolution look like for you personally and professionally?
Yeah, it's funny. I was teaching at the college last night, to the PT students that are interested in pelvic and an ortho lens of pelvic health as well. And I told them, I said, it's funny, in PT school, it was just, you do a curl up with a towel around your waist and get rectus abdominis. And that's really all we knew what to do with pregnant women. And I said, then we went through this evolution of transverse abdominis was the big thing. And I actually got a rehabilitative ultrasound 14 years ago.
Me too.
And
we're twinsies. The best. The best.
Amazing. And it was such an amazing lens to be able to kind of filter all the research, as I'm sure you saw. It was like, oh, research is saying we should do this. Research is saying now we need to focus more on the obliques. Now we are thinking differently about the diastasis recti or the interrecti distance. And to see it on the ultrasound really helped to filter professionally to figure out what you wanted to include and where you wanted to go. So that was absolutely fantastic. But it's been fun to see more data come out. I know even with my second child, we had some difficulties getting pregnant with our second. And so they said, you can't run. You cannot get your heart rate up. You need to, just basically sit for 9 months. And that was the advice given only 10 years ago. So it's amazing how much it has changed and how empowering it is.
Right.
Be able to tell moms like, no, you can still do this. You can still be active.
No, I bring that up all the time. And again, I was like, 10 years isn't that much time.
Yeah.
And there's so much that has changed. And do you have any FOMO at all? Like, do you wish that what moms have now is you had a little bit more access to for personally? Like,
yes, I think number one, I think just knowing like not the fear behind it. There was a lot of fear instilled, but two, more than FOMO, I have this, like, I wish I could go back in time and retreat all the patients that you've given advice to. And I told that to the students last night. I said, your first decade of your career is going to go back and have the opportunity to talk to patients and tell them the new information that we gave them the best information we had at the time. But now that information is different. They can do planks and they can do sit-ups if they have an interrecti distance, and they can do running if they have a prolapse. Like, you get the opportunity to change that. But I wish I could go back and tell some of those patients different information now that I have it.
Well, I'm thinking about specifically, these women who were fighting so hard to be relevant on the pro scene. And just forcing themselves through. And on one hand, they're being told you're doing too much, but on the other hand, like, if you don't do anything, you're going to lose your contract. Like, I again, like, it's such a double-edged sword. It's like, yay, glad we got you back, but there was a little bit better way to do it, but you didn't really screw yourself completely, but might have, like, I feel like we need a do-over.
we
for
need
some of these moms.
We need a do-over. And on the pro side, I also think that we still need more information. The sleep and the nutrition and the breastfeeding, those aren't my forte. Those aren't my strong skill set. And I think that's where we really set these moms up for not succeeding, is when they're showing, relative energy deficiency in sport. They're starting to see some of those signs, even if they get their cycle back and they're not checking the tick mark boxes, they still are going into relative energy deficiency, getting bone and stress injuries because all those other things aren't well managed. And I think that's hopefully where our profession goes. I'm sure you see that all the time.
No, I'm so glad you brought it up. We had a conversation earlier this year with Rachel Drake about that. And then also Molly Huddle just posted on with the Huzza Hub her story and mentions you. I think that's one of the things, like, I feel like Reds burst onto the scene, just the everyday algorithm, probably maybe a year and a half ago, 2 years ago. But I just, again, I feel like we're having these conversations about bone stress injuries and energy deficiency and lactating athletes. Number one, because they're out and about, and, bless Sophie Power for her, image, I'm sure that she didn't realize was going to go viral, of her, breastfeeding in the middle of, an ultra. But like, these things are happening now, but women are sharing their stories of these bone stress injuries. And I'm just like you, it's like, okay, how do we figure out what is too much and what that right dosing is? So how are you navigating, like, are you starting these conversations in pregnancy? Because obviously, like, even before they get to that lactation point,
Yeah.
they want to keep active, they want to keep running,
Mhm.
but there's different demands on their body, stress wise, nutritionally, energy wise. Like, how do you start that conversation?
Yeah, I mean, I think that conversation comes by giving them the algorithm so that they can personally do the check mark boxes, look at some of the things that their body are giving them those early cues.
Hmm.
And the biggest thing is when they go out and run, whether this be pro or your recreational runner, if they go out for any type of activity and they come home and they have to take a 2 hour nap after their activity, or they wake up and they are feeling either pain or more fatigue the next day, they know that they've then pushed the limit too much during that time frame. So I really use kind of them cueing into their body all the way from when they're pregnant all the way postpartum, obviously, to try and navigate that. But the sleep, I think, is probably one of the biggest factors, sleep and stress.
Yeah.
And I think those are hard things for people to necessarily navigate sometimes, especially when you have a newborn that isn't
Hmm.
sleeping, your sleep is disrupted, and that's obviously when the body's healing itself.
Yeah. Well, I feel like it's such a clash of mindsets, especially if you are a very, even if you're not a pro athlete, if you're a
Mm-hmm.
very type A athlete, that you've always been taught or always accepted the identity that you can just push through.
Mm-hmm. Yeah.
And I've seen a lot of moms here. We have a
Mm-hmm.
lot of older moms here in DC. I can say that because I was one.
Mm-hmm.
Um, where you've been able to control everything in your life up until this
Yep.
point. And so you think, I'm going to be able to apply this same mindset to becoming a parent.
Yep.
And it doesn't work that way at all. And
Yeah.
those are the moms that I worry about,
Mm-hmm.
because they may not have the ability to listen to their bodies, because
Mm-hmm.
everything up to that point has told them no, I got
Not
this.
listen. Yeah.
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 I can just do more. I can do more.
Hmm.
But on that scene, I think also motherhood changes people in some regards that, they have something else. They start to learn that they can fit only the amount of training that they can into the day. And it's neat to see, even though their career was number one, motherhood kind of take that precedence
Yeah.
afterwards. So that's a great thing that I think happens at postpartum as
Yeah.
well.
I wish we could plug that into pregnant brains sooner. But then again, that's where
Totally.
I have to give so many props to some of these athletes that,
Yeah.
their kids are toddlers now. I'll bring up
Yeah.
Rachel again, that she just won the JFK 50
Hmm.
and was very transparent. I guess she's in residency now. And then,
Hmm.
she's got her child Lou and navigating,
Yep.
trying to do this training and all of this. And
Yeah.
she's like, yeah, I don't run as much as the other people. I'm not
Hmm.
looking at anybody else's
Hmm.
Strava, because I
Yep.
don't have time for that mileage. But
Yep.
being a mom makes me make these choices that I need to
Yep.
choose sleep, or I need to choose this
Yep.
or that. I
Hmm.
feel like that's a wisdom that it takes a while to get in
Yeah.
postpartum. And it's a wisdom that maybe you can hear it in pregnancy,
Hmm.
but it doesn't resonate the same way until you're in the shit, quite honestly. I mean, what do you
Yeah.
think about all that?
Yeah. I mean, it takes time. I mean, I always say like motherhood is, you don't get an instruction manual and you get a baby and here you go. It's like you just
Yeah.
try and be the best you can with the information you have, which is partially why Shannon Robury and I are writing a book on pregnancy, because we want people to have a guide and have
Yeah.
those tools, because once they come into the clinic, you're trying to go, okay, how do I help you navigate your SI dysfunction? How do I help you navigate your low back pain or your pelvic floor disorders? And there's all this other information you want to give them. I'm like, I'd like to see you for 30 sessions, please.
I
Um,
know.
so just trying to give people a roadmap, and,
Yep.
knowledge is power. So the more knowledge they can have about their pregnancy from the day they get pregnant all the way through that first postpartum trimester or the fourth trimester, so that they can figure out what movement is medicine and how to dose
Yeah.
things appropriately.
What are the most common things that you wish moms would seek out PT sooner for in pregnancy? What are the
Whew.
things where you're like, dang, I wish I could have seen you like 6 weeks ago or 3 months ago, or I had one of those yesterday. So I want to hear your answer
Yeah.
first.
You know, I think a couple of things come to mind, like from an upper extremity standpoint, when people are like, "Oh, I have carpal
Oh my
tunnel and
gosh.
it's on both sides." I'm like, orthopedically, that's not carpal tunnel. That's rib position. That tends to be, looking at kind of what's happening up in the upper area. So people navigating that, I think not knowing what they can do for the cardio perspective, that's also huge. Women just feel like, oh, I wasn't sure what to do. I wasn't sure how much to do. And then obviously anything from a stress incontinence standpoint or pain standpoint that they have in the pelvis, I think those are really important to come in sooner.
Yeah. I had the worst de Quervain veins, which they refer to as mommy thumb or it used to be blackberry thumb, but nobody has blackberries anymore. I had it the worst with my oldest, and it continued on into postpartum. And so I would be like changing my son and he would accidentally kick me right. Let's see where right here.
Yeah.
Oh my God.
Yeah.
Worst. And that's when it's great to have a best friend who's a PT that does house calls, who's had kids. And he's like, I'll be right over. I'm like, thank you, Jesus.
I'm actually married to a PT, so I sometimes have to wave the white flag and be like, can you just do this, this, and this? He won't actually evaluate, but he'll do any treatment that I'm asking.
You're a better woman than I. I married the IT guy, which trust me has good news, bad news. But my email got hacked while I was in labor with my oldest. So while I was initially in labor, he was unhacking my email. So good to have that.
Well, I was going to say, and the other one I think is one of the most common myths is round ligament pain. I think people, if they could just come in, I'm like, not everything can be blamed on the round ligament. Like, let's orthopedically look at your pelvis, look at what else could be causing it, or medically, if there's something that's really driving it, that's, that the doctor needs to know about. So I think round ligament pain is this overdiagnosed, like everything. Oh, that pain is just from round ligament. It's like, well, no, actually orthopedically look at it.
And everybody's an expert on that. Like, I can't tell you, all the Facebook groups are like, oh, that's round ligament. I'm like, bullshit. It's not. Like, it's SPD. So that was the one I was going to bring up. I had a client I was talking to yesterday, and she'd been seeing an orthopedic PT, did not acknowledge or did not recognize she had symphysis pubis issues. It was very clear during split squats. I'm like, okay, you can't get any more clear than that. And you can address it. And she's only got a couple weeks left. And it's like, she's like, well, I'm not really doing much anymore.
Yeah.
But again, people, the way I kind of describe SPD versus round ligament, the way I experienced it, I would be curious to you. Like, if you go to stand up, it'll kind of like catch you, and then you take a couple little steps, and then it sort of eases out, and then you're fine. But it catches you kind of on the inside of the pelvis bones. But SPD, typically asymmetrical weight bearing, rolling in bed, or things like that. Like, they're very different. It's not hard to tease it out.
Very different. And orthopedically, you can stress test, the pubic symphysis. They can't put their pants on without lifting one leg. Trying to push in a chair or push in a drawer with their leg, it gives them pain. So it's very, very clear, usually orthopedically, that it's getting driven from the pubic symphysis.
That one I love to do via telehealth, because I'm like, look, this really isn't hard to figure out. I'm like, I don't even need to touch you for this. I was like, this is what we're gonna do.
Totally.
Yeah. All right, let's talk early postpartum, because that's where I feel like there's been a really huge shift in our profession as far as early care. Like, back when we first started, it was like you weren't laying your hands on anybody until you have a clearance order at 6 weeks. And now we're saying sooner is better. And we did have some, albeit like it could have used a little more mention in the ACOG white paper in 2018 about the fourth trimester. They could have said a little more. We're just going to be honest about that. When did you start to make the shift to early care, and what does early care look like for you when you're working with somebody?
Yeah, that's a good question of when. We started something called the Bump to Baby program. And I would say it's been over a decade that we did Bump to Baby program, maybe even 12 years ago. And what that entailed was giving them all the information during pregnancy, helping them do a birthing preference plan, 36, 37, 38 weeks, and then seeing them postpartum. I always had them come in after they've gotten settled with breastfeeding, and 2 to 3 weeks postpartum, they would come in. And because we had the rehab ultrasound, we were using that at 2 and 3 weeks, saying, okay, what's your core look like? Let's get you started on core. Let's take a peek at your pelvic floor. Let's look visually, externally on the pelvic floor until you get cleared for intercourse. And then we would do internal at 6 or 8 weeks, depending on when. So we've really followed that path or pattern. But I think, again, the rehab ultrasound really is probably what drove us for doing that
Same.
earlier than what I think most of our profession was doing. So,
Yeah, no, and that's the thing that I do appreciate about the interwebs and social media is that you and I did not know each other then.
yeah.
But yet we were kind of thinking this, and that's what I
Doing the same
love.
thing.
I've talked to Sarah Tanza about this too. I
Oh,
was like,
yeah.
we didn't know the other existed. We were coming up with the same ideas, and now I feel like I'm not stupid. I know things.
Yeah, absolutely. You're like, I'm rocking the boat a little bit. I know my profession isn't doing this yet, but it makes
Yeah.
clinical sense.
Right.
And, then you get out there and you're like, oh, yeah, this is great.
Yeah, and that's when you know you're like, I'm in the right room. You're like,
Yeah.
oh, you thought of that too. I wasn't so crazy.
I love it. Love it. And
Yeah.
I love Sarah as well.
I know.
Oh.
Again, I have this huge group of people. I'm like, we need to have a super secret running therapy group that we meet in an undisclosed location and just have a good time for a very long weekend.
I love it.
Yes, we will do that. No, if you're listening, you're not invited. It's just for us. No, anyway. Yeah, so I feel like early access has made a huge difference.
Yeah.
But I also feel like and the downside on social media is it has kind of opened the door for, okay, am I running? I'm going to run as soon as I possibly can, or I feel great because my kid's sleeping and eating, and I'm going to go out and do this, and so on. And in 2019, we did get the UK guidelines from Emma and Grania and Tom, which I feel like was such a great start.
Yeah.
Again, a lot of us were doing similar screening sorts of things, and we're like, we need a framework to work around. What is your process when you're trying to navigate with someone, whether they're pro or not? Like, when should we get this party started for a walk run program? Because I feel like that's kind of this moving target.
Yeah. I'm always going to use the answer. It depends, right?
Oh, of course. Yeah. No.
Just depends on their mode of delivery, depends on their mental state, depends on all the different factors. But I think the number one thing is just getting them out on a really small walk and telling them, I want you to go around the block. I don't want any out and backs. I see so many times moms will go, oh, I'm just going to take my toddler to the zoo for a 2-mile walk, and they get out a mile and they realize I can't get back. And so we really start them pretty early on. We say, rest that first week, then go out and get outside and just walk around the block and see how you feel. If that feels good, you can start going another loop around, but really making small dosages that way. So we really progress it pretty early on, but we're talking a 1 block walk when they're first starting.
Yeah, no, we had, we lived in the Roslyn part of Arlington, which just overlooks the Potomac and Georgetown. And we had a little kind of terrace that the first time I went out with my oldest, I'm like, oh my freaking God, I am not going to get around this like ever. And thank God, I eventually did, but you got to start somewhere.
Yeah, I, being the PT, did not follow any of my own advice. And
of course.
I ran at 2 weeks postpartum with my first, I have a 200-meter track by my house. I thought, I just want to see if I could do it.
So clearly you were feeling well.
Clearly I was feeling well. And
I was not.
Not any guidelines, right? There wasn't any things that you have to start at this time. You have to start at that time. And then with my second, we went on a pretty long hike, 10 days afterwards, and it was fine. Went for 2 miles, but would I advise that? Probably not.
Well, and I think that's the thing that, if anything, when you're talking to somebody and they're looking at this for themselves, they hate it when we're like, it depends. I'm like, but it freaking does. Like, it does. We can give you the broad expanse. And I think for both of our situations, like I was in no state, like it wasn't even on like me getting out of the house with my first was just like, yay, okay, you can do that. So running wasn't even part of the conversation. The people I actually worry about more are the moms that everything went really, really well, or it went okay. And running is such a huge part of their identity and a part of their mental health management. And if things are not going as planned, or you've got stressors with kids, colic, not sleeping, all that other stuff, this becomes a stress management issue.
Yeah. And
That's what I worry about.
that's a huge factor to factor in. What can they do for their stress management? And also, if we do tend towards exercise compulsion, making
Mhm.
sure that they're not starting too early. I think both of those things, sometimes maybe they should start a little earlier if it is part of their mental health and they've got a good grasp around it, versus on the flip side, if exercise compulsion is something that's in their history, that then maybe they need to delay a little longer because they know they're going to overdose it. So
Yeah.
it's definitely a fine balance between those two. And then you have to look orthopedically, right? And
Mhm.
biomechanically. I always say it's no different than if you had an ACL tear. I'm not going to release you for running until you can pass all the orthopedic tests
Right.
biomechanically to make sure you're strong. So really
Yeah.
making sure that they have those as parameters, and are focused on kind of getting back in that regard. No different than anybody who's had surgery.
Yeah. And even with that, and I think this is again where we have a lot to figure out still, because we
Mm-hmm.
have moms running sooner, we have moms doing
Yeah.
well, and
Yeah.
we've got some clearance. Sometimes you can do all the quote right things
Yep.
and still end up with bone stress injuries.
100%.
And I'm hearing more stories of that
Mm-hmm.
come up in
Yep.
the media, people sharing their stories as pro athletes,
Yep.
and I appreciate it because they're being honest and upfront and saying, hey, this is
Mm-hmm.
what happened to me. I did all the right things. I worked with all the right
Mm-hmm.
people, and this
Yep.
still happened. And we're still trying to
Yeah.
figure out why.
Yeah. Yeah.
Um, in the rear view, because I'm sure you've
Mm-hmm.
heard some of these stories, we're not going to
Mm-hmm.
name names or anything, but
Yeah.
like, what are the things that we need to dive further into, or, where are there opportunities for us to um, be better acquainted with what's going on with that athlete?
Yeah. I think two things. Number one, I don't know, or I'll be interested to see if research tells us it's not biomechanical for the stress related
Mm,
injuries, because you can have an athlete who's super strong biomechanically past those. And it goes back to that nutrition, sleep. The bone is recycling constantly. And if they don't have enough calcium stores, or they don't have enough sleep in their system, or they have too much stress, I think we might see, at least that's my hunch, is we might see it be more of the other factors that we aren't looking at yet.
mhm.
So I think that can be number one. Number two, it takes 6 to 9 months for our ab tone to return to normal. And when you think about the anterior tilt that happens for pregnancy, I would love to see more research on what that anterior tilt does, what it looks like at 0, 3, 6, 9 months postpartum. Because if you stay in an anterior tilt, even by 3, 4, 5 degrees, you've now got more pressure on your lumbar facet joints. Your sacrum is in a different position. So now you get different
Mm,
sacral torsions. And you think of somebody with femoral acetabular impingement. Now I've got more pressure onto the anterior aspect of the hip. So
yeah.
I really think we might, I think we'll see more research that comes out of it, but I think it's going to be less about your leg strength and your hip strength, and are you biomechanically perfect on all those tests, and there might
Yeah.
be more that follows those paths.
Yeah. No, I was thinking of kind of two separate but related topics. Looking at that, and the research is, we're now saying, hey, maybe we shouldn't be backing off ab work in pregnancy so
Yeah.
much, and not be avoiding rectus in
Yep.
postpartum, because don't worry about IRD
Yeah.
distance, the
Mm-hmm.
interrecti distance. Should we be doing more abs across this whole time period, which would
Mm-hmm.
ideally help with that? That's one thing I
Yeah.
was thinking of. And because I think even with the best intentions, we don't.
Mm-hmm.
Um, and then the other one was, oh, it flew right out of my head. It was a good one. It'll come back to me. No, but
Well,
like, no,
but
it,
but you're right on, right? Like rectus is so important, and when you think about
mhm.
that anterior tilt, rectus is what brings your pelvis
Yep.
back into a good position. So rectus training both during pregnancy
Mhm.
and postpartum, as we see now in the research this past year, is
Yeah.
really coming to the forefront again. And
Yeah.
I really, it'll be interesting to see if someone does all that rectus training, gets their anterior tilt corrected, do we see less bone stress injuries? It
I'm
could be
curious.
something that comes up.
Yeah, the other thing I was thinking was, now that we have a little bit of data looking at what mechanics of running look like in pregnancy versus postpartum, kind of
Yeah.
what those trends are, what are things that we can do to kind of target that a little bit differently? And
Yeah.
I love these studies because we read them, we're like, yeah, that's totally what's happening. You're like, you know what a
Yeah.
pregnant woman runs like. And what I always tell like my patients is I'm like, okay, so your brain is still operating like it's pregnant. You're still walking like you're pregnant and
Yep.
you're not. And we need to get reacquainted with what's going on here because you're
Right.
literally still, I mean, everybody knows what I'm talking about when you walk
Yeah.
with your belly up because you're so proud, you know? And then afterwards, you can't get that sucker shoved back in. So,
Yeah, it's a
even
lot of
just,
retraining.
yeah, I mean, even just talking about like obliques and rotation, I feel like obliques are having a moment these
Yes,
days.
they are.
And be like, yeah, you know, we don't have a lot of capacity to rotate because, you know, that baby's stuffed in there and your diaphragm's in lockdown and there's not a lot of place to move. And it carries over into that
Yeah.
postpartum. Like we need to find these movements again.
Yep. And train the whole core, right? It's always
Mm-hmm.
been about the whole core. I know, I'm sure you saw on the rehab ultrasound as well, but I was like, as soon as you can activate transverse abdominis, I want you doing your six pack
Mm-hmm.
abs or your rectus abdominis. I
Yeah.
want you working your obliques. You have to be able to be strong in all of them.
Yeah.
And they all have had their moments in our history of
Right.
you and I through our profession, but
Yep.
in all actuality, I think they're all important. They're just getting
Yeah.
highlighted at different parts of the decades.
Yeah. Well, and again, it's the pendulum though, because you've got, you know, the weekend influencer experts out there that are
Yeah.
like, only do it this way or only do it that
Yeah.
way. And I very much know that again, the time that we were brought up in this space, that was very much, you know, the mindset that we were taught. And I think the research now has allowed us and our critical thinking has allowed us to be like, actually, no, that minutia like doesn't help anybody.
Yeah.
But that's what you're constantly fighting is like, you want to do the right thing. And like, well, maybe the right thing isn't getting so in the weeds, but
Yeah.
our profession likes to do that a little bit too.
We do, or we grab a research article and then we take what we want out of it.
We
And
cherry pick. Yeah.
it's with good intention for sure, but you always have to look at it through the lens of all the other research that's out there and kind of
Mhm.
what we know from our clinical reasoning standpoints.
Yeah. Well, and I think we also get our head buried in the sand about, well, if you're this way, it's because of this. And I'm like, okay, look at all the other people in the world that are that way and they don't have the same problem. So how can
Right.
these two realities coexist?
Yeah.
Well, maybe that's
Yeah.
not it, you know?
Yeah. Yeah.
But we don't like to take our head out of the sand sometimes.
I think we're getting better. I feel
Are
like
we? Okay, good.
yeah, I really feel like you know, even teaching last night at the college, they're so open to learning. They're so open to going, okay, well that's different now. Great.
Mhm.
Let's teach it a different way versus I feel like a few decades ago we did kind of have our ways. Social
Mhm.
media has been good for that because we
Yeah,
can
I agree.
share information a little faster. It's also been bad for, you know, publicity because I think there's a research article out there recently that said women go and seek thinking they have a diastasis recti because we've created a problem of it, and most
Mhm.
women that come in actually don't have an interrecti distance that's problematic.
Mhm.
So there's good and bad to being able to share things so quickly now.
I joke that 90% of Northern Virginia thinks that they have a diastasis recti. I get to be Oprah and be like, "You get ab work and you get ab work." But again, to me, it's a gateway diagnosis
Yeah. Yeah.
because typically if somebody thinks they have that or that's what they're searching for, it's an indicator of something else. Like,
Yeah.
you know, they're unmet expectations, body image, those sorts of things.
Yep.
And then when
Yeah.
you get to start to have a conversation, you find out, oh, they're having pain with sex, or oh, they're having
Yep.
leakage. Oh, to find these
Absolutely.
other things. So you get to give them their ab work back,
Yeah.
but
Yep.
then you have an opportunity to have a conversation about things that actually do matter.
Do
But
matter.
again,
Yep.
like it's a situation, and I very much feel this way too. Like I had a decent diastasis after my second. I've had 2 C-sections, so that's not shocking. My kids were big, but very much I was like, oh, I can't do this, I can't do that. And then one day, another PT, he's just like, you're just weak, and I'm like, oh. But to this day, kids are 11 and almost 14. I still feel like that is such a big deficit for me.
Yeah.
That's what holds me back in CrossFit, which I think that leads into other kind of running stuff that I had. Like And I look back at that and there's so much, I wish we had known a lot of this stuff sooner.
Mhm.
And I wish there hadn't been so much fear. And I
Yeah.
can't imagine being a pro athlete
Mhm.
and going down any of those fear-based rabbit holes where
Mhm.
you shouldn't do X, Y, and Z, but here it is like your livelihood. I mean, I would
Yeah.
hope that it's common sense to be like, oh no, now I have friends that have gone through this and it's okay. But like,
Yeah.
have you had to navigate that kind of line where, yeah, they're athletes and they understand
Yeah.
movement, but being pregnant is a whole different beast.
Yeah. I think I was fortunate. Jackie Whitaker was a researcher up in Canada. She came
Yeah.
down and taught rehab ultrasound for our
Awesome.
team. I had met her through the years, and we really talked about kind of the posterior band of fascia underneath that inner recti distance. My orthopedic mentor, him and I started doing some research on it early on. And so we were just seeing time and time again, people would come in and it's like, oh, well, you can activate your transverse, you can activate your core well. We see that interrecti distance. We see the good posterior band of fascia. And so really pretty early on, we were able to say, we don't think this is a big deal.
Yeah.
And I think there's only in 2 decades, I've had 2 people that have undergone surgery for
Hmm.
interrecti distance. Other than that, that everybody else gets back to a point where they do really well. So it
Hmm.
hasn't been, I think, in part because the ultrasound, they come in and you
Yeah.
say, they're like, I have a 4 finger width diastasis. And I'm like, well, ultrasound's the most reliable.
Yeah.
Let's actually see what that looks like.
Yep.
And then you go, look, you have a great posterior band of fascia. You're good to go.
Yeah. No, I do feel like the ultrasound has been incredibly empowering because you're not
Mm-hmm.
just relying on somebody's opinion. Like, you don't
Right.
have to trust me. It's
Yep.
literally there in black and white. You watch
Yep.
what's happening when you do this, that's
Yeah.
what happens.
Yeah.
But I also feel like, and you grew up in the era of you learned
Yes.
biofeedback from your first pelvic floor course that I haven't
Yeah.
touched since I got my ultrasound.
Yeah.
Um, just having an ability to connect to that information and being like,
Mm-hmm.
okay, everybody's telling me all this, but now I'm literally seeing what this looks like. And now I have a way to get feedback on what I'm doing. I feel like it's far better and far more
Yeah.
accurate and
Yeah.
more functional.
Yeah. And when you tell patients, hey, I'm going to remeasure this, they
Yeah.
really do their exercises because they're like, I know you're going to bring that machine back out, and and I get to see it again and see if I've made progress. So that's really, really fun for them.
I would imagine the athletes are very competitive. Like, I'm going to
They
do better this
definitely,
time.
yeah, or definitely make sure that like that exactly was 30 seconds, or we did exactly 12 on one side and 12 on the
Yeah.
other. So yeah,
Yeah. No,
attention to detail matters.
we do that here too. That's awesome. That's awesome. All right. For those that are listening that I think especially newer therapists and
Mhm.
and coaches and trainers that, we come out of school and we're like, we want to work with, pro athletes and
Yeah,
that kind of stuff.
yeah,
How did you get involved working with these higher level athletes that, do go on and, go to the Olympics
yeah,
and all that kind of stuff? What
yeah.
was that journey for you?
Yeah, I have to think back. The first athlete that I saw actually came from a sports agent. I had been seeing a sports agent for his own condition, and he was super impressed. And so he started sending me pro athletes that weren't in the running space. But so kind of got that, I would say probably 2 or 3 years into my career. So fairly early did that start. And then kind of breaking into the pro running space, it really came because a colleague of mine knew I had the ultrasound and said, hey, let's explore, like, let's see what the core looks like on several of these athletes, and knew and valued that pelvic health should be a component of the orthopedics. And so
Hmm.
we just started playing around and seeing, like, how much does this matter? What can we do to improve both core and pelvic health?
Hmm.
And then a few other of them came from their OBs when they were pregnant, because the OBs knew me in town. And then word of mouth kind of just kept going from the athletes. But I would say the biggest piece of that is having a strong orthopedic base.
Yeah.
And I went through the North American Institute of Manual Therapy, and
Hmm.
the amount of clinical reasoning and differential diagnosis you get from those. You can test every ligament in the ankle. You really know your differential kind of medical diagnoses, and
Hmm.
you really can put together the biomechanics and say, oh, your Achilles issue is actually because thoracic
Yeah.
spine rotation, and this is happening in your gait. So I think really having that solid base would be
Mm-hmm.
my recommendation to anybody who wants to work in the athlete space,
Yeah.
because you can Google almost anything and find basic exercises, but you really have to become a master of your craft.
Yeah. No, I feel like that is a point well taken. One, that was my journey, orthopedics
Yours too.
first, and
Yeah.
yeah,
Yep.
exactly. And
Yep.
so obviously that's going to always be my bias, but especially I think with the popularity of women running and doing CrossFit and yoga and Pilates and
Yeah.
functional fitness and all this kind of stuff, I think there's a lure to it from a lot of our younger professionals.
Yeah. Yeah.
And but I do see a gap
Mm-hmm.
because they if you're going just straight into pelvic health and you don't
Mm-hmm.
have additional background. That's what I love about Sarah too, with
Yeah.
her neuro background and that kind of stuff. I'm like, I
Yeah.
feel like you have to have a little bit more comprehensive view
Yes.
and really sort of understand running, because if you don't, I see second and third
Mm-hmm.
opinions all the time.
Mm-hmm.
And my personal favorite is when people are told to Kegel before or while they're running. And I'm like, are you freaking kidding me? Like, how is that even possible? Like,
Concentrate really hard.
I'm like, yeah, you can think that fast. Like, those are some fast quick flicks. Like, I just I that's some of the advice that I give sometimes to people
Yeah.
when I'm like, hey, when you're looking to find somebody
Mm-hmm.
in your area that might meet your needs, like these are the
Mm-hmm.
questions that you want to ask. And it's fine if they don't have that background, but who do they work
Yeah.
with that does?
Yeah. Yep. Absolutely. And partnering in that team, we've
Hmm.
had athletes who are overhead athletes or XYZ,
Right.
and that's not my forte. That's not my space. So when
Yep.
you're working at the top of your skill set, you want to make sure that they have other team members that can help in that capacity as
Yeah,
well. So,
absolutely.
yep.
What's been the most bizarre, or not necessarily bizarre, but the least popular sport that you've ever had to work with?
Oh, least popular sport. I wouldn't say least popular, but the one I know the least about was a professional fencer. And it was like, I don't know the biomechanics of that. Like, I'm not even really sure. So I think kind of getting people back to those types of high level activities
Yeah.
where if I haven't done it, if I haven't played the sport, I want to make sure that they have the best advice
Hmm.
that they can.
I have a similar story. It was somebody who did sword fighting, but they did a lot of the like those Renaissance fairs. So they
Yeah.
would go sword fight every weekend. I was like,
Yeah.
you're gonna have to walk me through this because
Yeah.
I have no freaking idea what you're
Yeah.
talking about.
Yeah, those are hard. And
That's
even,
really physical.
I'll be honest also, pickleball, I have not picked up the sport yet. I know everybody else has, but when someone comes in and they go, I do pickleball, I'm like, yep, I don't know what to help you with. You need to
We
learn the biomechanics.
we have
Um,
I'm sure you've heard of him. We have a very famous ultra runner that lives here in Arlington, Mike Wardian. And he's done like he like ran across America dressed like Forrest Gump. Like he had like the marathon record of like the fastest stroller marathon, or world record of
yeah.
fastest like he does all these things. Anyway, point being,
These things.
he's into pickleball now. So I'm like,
Yeah.
I'm just like, I mean, he's still doing all these other things, but like he's doing pickleball. So I'm like, all right, let me see how this plays out.
Maybe we should have a course that teaches us biomechanics of all the sports, right? Like that would be amazing.
I'm also I would never did, and you did track and cross country.
Yeah.
I wasn't a ball sport girl. What did you
Oh
do in
yeah.
the winter?
I ran year round and I lived in North Dakota. So that's saying something. We would come back and our eyelashes would be frosted white and
Okay.
it'd be 50 below zero and you'd head out on a dirt road with the
Wow.
wind at your back. And so I was a year round, one of those single channel sports. But also
I-
did skiing and snowboarding and
Okay.
things for fun.
My first job was almost in North Dakota. In
Oh,
99,
really?
I'm sure you would remember there was like no jobs in 99, like the bottom dropped out of the market. And it was like a pediatric travel gig in like
Oh
Bismarck, North
gosh.
Dakota. I'm
Oh
like,
my
this
gosh.
seems like a bad idea. And then it just,
That's where I'm from is
oh,
Bismarck,
okay.
Michigan.
I had been to North Dakota before this. It wasn't like
Yeah.
I hadn't before, but I was like,
Hmm.
winter, North Dakota. And I'm
Yeah.
from Western New York. So like we're used
Oh
to
yeah.
snow and
So
that kind of stuff, but we
yeah.
also don't have like 50 below
Yeah.
temperatures.
Yep.
Needless to say, that didn't work out. But We had Nordic skiing where I grew up.
Yeah.
And
Yeah.
so I swam for a number of years and then switched high schools. And then junior year, I learned to Nordic ski with a bunch, like I was a junior and you're learning with like, 10-year-olds at this point.
Yeah.
And somehow got myself up to, I was able to go to States my senior year and
cool.
we skied at Lake Placid on the Olympic biathlon range, which is freaking amazing.
So cool.
But you should do that because there's so many cool people that Nordic ski. It's just not even funny. Especially where you are. If you don't, like, my God, like, pick it up.
We always had to just use the Nordic skier when we were injured in high school. That's not the same. So that's my only experience with Nordic skiing.
No. So we need to do that for you. No, this morning it was funny. The gym that I go to, it was cold for here this morning. It was 19 degrees, which is weird for DC in December. Right. And so they switched the workout. It was supposed to be a bunch of running and they switched it like, okay, you can do bike or the ski erg. I hate the ski erg. It's not even remotely close to doing classic. And by the way, skate is way better than classic, but I was like, I'll go run. And they're like, really? Like, it's not that much. And they're like, oh, Carrie, like, it's not a big deal. But anyway, I will put you in the group of runners turned Nordic skiers that we have slowly converted.
Yeah. I did say for 2025, my goal is to figure out something I like to do to cross train because, we preach it all the time of you need to cross train, you need to do some other activities aside from running and lifting.
Yes.
So
I am going to hook you up with Amy Leadham, who's been on the podcast now twice.
Cool.
And she has gone over to the dark side of Nordic and is loving it. It's the best lats workout and the best butt workout you will ever have.
Maybe we'll do that like group we were talking about and we'll just get together and run and Nordic ski and talk PT.
That sounds great. That sounds, we'll have a winter retreat and then we'll have a summer retreat. Yeah. And so the winter retreat will be at a Nordic resort. So it's all just working out great.
I love it.
All right. Looking ahead, where do you see the biggest opportunities for advancement in navigating pregnancy, postpartum runners? I mean, it's been light speed. I feel like the last couple of years, especially. Where do you feel like the next big changes are going to be, or the next big research topics are going to be?
I think clinically, the biggest change that I think we can make is getting people in sooner, becoming the standard of care where, after at least 12 weeks, we're getting you in and we get to start all the things we want to do. So I think that's number one. And then more research is still needed on what exactly we can do postpartum. It's a little vague on when should we start abdominal training? When should we go back to kind of these higher level sports? I think we're going to continue to see that research evolve even more than it has. So I think those are two. And then research, I would love to see us push further down the road than that fourth trimester, really looking at all these other factors we talked about of sleep and nutrition and calcium and even doing bone and DEXA scans and other types of things so we can really understand the impacts of what it looks like for people when they return at 6 months, 9 months, a year, 2 years out and see what we can do to continue to make a difference. Because you wonder why, you see patients 5-10 years down the road and they're like, oh, I have a hip labral tear, or I have a, femoral acetabular impingement now, or I have this L5S1 that is of dysfunction. And you go, could we have caught that postpartum? So I would say those are kind of our big opportunities. And it'll be fun to watch and see what evolves.
Yeah, that continuum, I think, is I'm totally in agreement there. Having kind of dove headfirst into perimenopause this last year, I turned around and looked back at postpartum in that low estrogen state. I'm like, oh my God, look at all the stuff that we're missing. Yeah. And to your point, if we have a better sense of what's going on in pregnancy, postpartum, how can we carry that forward and have an even more productive perimenopause? Because we do, it's not Blanche Devereaux anymore. I mean, I saw a meme the other day that she was quoting herself as, oh, I'm 41 years old. I'm like, wait, what? Like, where's my caftan? Like, I think we have so much higher expectations, and kind of what you're saying too, like you're performing better than you ever have. You're doing world majors and,
Mhm.
having great times.
Yeah.
This was not the plan,
Mhm.
but you're not walking away. You're diving into it further. So,
Yeah.
how can we take the lessons that we're learning
Yep.
and flip it around and tell our earlier, moms in postpartum, our pregnant moms, how can we go back
Yeah.
and change the narrative with our kids from the beginning
Right.
on what their expectations are, as they age? I
As they
think
age.
there's such
Yeah.
a huge opportunity.
Yeah. And can they get the strength training? Like just anecdotally on myself, I didn't start strength training until about 3 or 4 years ago. And that's when I
Hmm.
saw all my time start to drop, right? I
Hmm.
started doing all the plyos and the strength training. And you go, what if I would have done that 10 years ago, right? Postpartum,
Right.
after your second, go really make sure that we get that strength. And how could
Hmm.
that have changed biomechanically? How could that change orthopedic issues? I think
Right.
if people can get that information early, that's going to be key.
Yeah. Well, and that's
Yeah.
been a lovely, I think, parallel journey, what we've seen in the orthopedic literature and the running
Yeah.
literature and what we're understanding in
Yeah.
postpartum
Yeah.
is we do have data to
Mhm.
say, hey, strength training, lifting heavier is
Yep.
going to improve your performance. Heavy lifting
Yep.
over plyometrics, heavy lifting will get you a faster
Mhm.
5K time. Like,
Mhm.
hey, great. Who doesn't want that?
Right.
And
Yep.
if, oh, by the way, if we can gear that towards improving bone density, tendon health, all those sorts
Right.
of things, again, where's the loss here?
Yeah. Yep.
I didn't start strength training until, so I had FAI surgery 18 years ago.
Oh wow.
And then, yeah, back before Lady Gaga and A-Rod. Um, I mean, I didn't make it cool, but clearly they did. But I didn't start strength training till my second was in preschool. So she would have been like 3 or 4 years old. And I started
Yeah.
doing CrossFit.
Oh
And
cool.
between the time of my surgery and that point, I could run a little bit, but like
Right.
it was still, that's what saved my hip. Like,
Yep.
and made it so that, I did my first half like ever last year, I'm doing
Yeah.
10 milers, all sorts of things. Like that was a game changer for me.
Mhm.
And again, how do we change the mindset of moms of like, okay, you need to be lifting heavier things sooner.
Mhm.
And I don't mean ankle weights and I don't mean hand weights. Like,
Yeah.
can we need to take that,
Mhm.
image of that we grew up with in the 80s and the 90s of like these, we don't worry about bulking up. Trust me. I've tried. I want to bulk up.
Exactly. I'm like, can I build some muscle? That's
And
great.
by the way, it's sexy. Yeah, no, I feel like there's such an opportunity to kind
Mhm.
of shift that. But again, it's been really cool to see the parallels
Yeah.
and being one foot in each camp to be able to be like, hey, this is gonna collide and just be good things going forward. So
Yeah, yeah,
um
no, and it's exciting that now we have social media and things that can push that faster to
yep,
people so that they can get, that knowledge. Because if you don't know the knowledge, you don't know that that's something you're supposed to
right.
do. And
Yeah.
not just the lifting, but, the multiple plane movements, playing pickleball,
Hmm.
playing basketball, tennis, all of
Right.
our kind of lateral movement sports, which help with their bone density for a long period of
Yeah.
time, so
Well, even oh gosh, I don't know if it was looking at like ACL or oh, it was some paper looking at a comparison of, adult runners, what sports they did growing up, and the
oh,
kids
cool.
that were only runners, so you're in this crew,
I am
um,
100% in that
I
crew.
I can't remember exactly what it was, if they were more they had more, increased risk for injury or more injuries
Mhm.
as opposed to
Yeah,
the kids that did,
yeah,
ball sports, so like soccer,
yep,
basketball, like
yep,
cutting, those sorts of things,
yeah,
which I never did, and I don't think, well, Nordic skiing, it's not really cutting. We did
yeah,
diagonally,
yeah,
so I don't think that counts. But I'm like, again, these are things that, gosh, I wish we'd known
mhm,
this.
yeah, yeah,
Um,
single sport kids are the most
yep.
prevalent, right, for injury,
Hmm.
and so just encouraging any other type of activity, whether
Yep.
they're teens or whether they're, in their
Yeah.
40s and still kids playing their sports, right? Like we are.
Yeah. Are your kids runners or they do other stuff?
You know what's so funny is my oldest is really into soccer. And one day I said, I know biomechanics of running. I said, you're a really good runner. I said, you should go out for
Mhm.
cross country. And he's like, no. And I made the mistake. I said, I'll pay you if you place top
Oh,
3 in any race, because I really think that you're a really strong runner. So long story short, the first 3 races he did, he went out and either led them or got second place. So the cross country season was very expensive for me. And but he
whoops.
hates it. He hates the individual sports, and he's like, nope, I only want to play soccer. I like the
Whoops.
team sport. So I don't think I'd repeat that mom move again. But then my youngest, he loves like short sprints. He loves
Nice.
playing tennis. He loves soccer. He loves swimming. I think he'll be a hurdler someday. He loves to go to the
Oh, my
track.
mom wouldn't
He
let
has
me
no
hurdle.
fear.
She's like,
He
no
has
way, you're not
no
doing
fear. He has
that.
no fear, and he jumps right over the 30. He'll even go over a 33-inch hurdle, and he's 10. So he's got no fear there. So we'll see
Okay,
what he
well,
ends up loving.
that's awesome.
How about
I
your kids?
love it. My youngest is my sporty girl. She in
Uh-huh.
the fall, she does field hockey, which I'm still learning. Winter,
Yep.
both kids do rec basketball. My
Oh,
daughter
cool.
does swim year round, but we tone it back. She swims like once a week and then she'll do summer swim.
Yeah.
She does softball in the spring. He used to do baseball, but around here, everything gets so freaking serious by like age 11 that,
Yeah.
he didn't do that. And then they play golf and,
Yeah.
it's like a little bit of everything.
Yeah.
My daughter just did the turkey trot with me. We just, do
Oh,
fun run stuff. And I'm like, you know
that's
what?
great.
There's no pressure here. You just need to be
I love
active.
it.
That's all I
And,
care.
yep, and just a lot of shuffling around, right? A lot of carpools.
Mhm. And a lot of strategic
Yep.
activity. Well, because I'm
Yep.
not sitting on bleachers.
I know, but I'm the mom. I do all my core, my neuromuscular training when I'm watching the soccer game. So I have my band,
That's
I
smart.
bring a weight, and you're there for a 90-minute game.
I
So
know.
I do a full workout on the sideline. I'm sure my son's like embarrassed that his mom is the one doing plyos and jumping, and
No, I
but
did.
you have to use that time wisely.
I did a whole podcast last year on. We have a group of summer swim moms that there was one mom that would just walk the property during
Yeah.
practice,
Yeah.
and then other moms see and they would just join, and then
Mhm.
when their kid leaves, then another mom joins, and like you just like it's just one of those things that like, hey, we're here anyway. We might as well.
Might as well
be
get it
doing it.
in. Yep.
We got to do our
Yeah.
stuff anyway, and it's too quick of a practice to run home and come back, and yeah.
Totally. Yep. Or they have to be 30 minutes early for a game. I'm like, oh, that's great. I can
Mm,
run for 30 minutes and be back
mhm.
and then do your core
Yep.
work afterwards. So
See, if you have little
fit it all
kids,
in.
take these tips. Trust me. It took us a while to figure it out, but we did it.
Absolutely. And to feel, okay, this isn't awkward. I can do this. Like it might seem
Right.
awkward at first, but one
No
time
one
I had a couple
cares.
bands and someone's like, can I join you? I was like, sure, of course you
Exactly.
can.
Exactly. We're all in the same boat. So mom
All in the
tips
same
from
boat.
Jess and Carrie.
Yep, totally. Whole podcast could be on that for sure.
Oh my God. That's what I told you. I was like,
Mhm.
we could have like 7 podcasts. All right. So we're going to have to wrap this one up. But at the
Yep.
end of every episode, I have a couple questions for everybody. So first one,
Okay.
book that you're reading or podcast that you're listening to right now.
Oh, book. I just finished a book, and it's Thanks for the Feedback. It is absolutely
Mm,
phenomenal. We do it as part of our business leadership series. I've got a group that we read, but it is applicable from business all the way to your personal life. So highly recommend that book.
nice. I like one that crosses.
Yeah, multi-purpose, right?
Yes, we had James Clear on a couple years ago, who wrote Atomic Habits, and he wrote it
Oh,
before he
yeah.
had kids. I was like, dude, this is not a business book. This is a parenting book. He's
Love
like,
that.
yeah, I can see where you're coming from.
Mhm.
All right, next one. Favorite activity since becoming a mom?
Ooh, favorite activity. There's so many. I think the holidays come to mind just because that's what it is.
Yeah.
The holidays have such this like excitement and glamour with them again. They bring back the sparkle of the holidays. So I would say probably just holiday activities and then doing silly stuff like we went to go-kart racing the other day. And I would have never done that if I didn't have kids.
And kids are brutal. They want to win. They want to beat
And so do
you.
I.
Yeah, there's no competitiveness in your family, is there? Not at all. All right, I'm going to tweak this one. One piece of advice for moms who are runners.
Oh, can I do both? Because I have a really good one for moms too.
Sure, go
But
for it.
for moms, you're the best mom that they know, right? I think sometimes
I like that one.
you get wrapped up and you're like, am I doing this right? Am I nursing them right? Am I putting them down at time? And you're the only mom that they know. So just know that you are the best that they know.
I love it.
Best piece of advice for moms who are runners is really listen to your body and know that running is going to be there for a really long time to come. You don't get those moments back. They're precious. If you don't start training, on day 6 or day 12 or week 12, it doesn't matter in terms of you never get back that time with your young kids. And so don't put too much pressure on yourself to bounce back like society tells us to do.
And easier said where we sit than we understand. If you're in the middle of it, we understand how hard it is to reconcile that.
Yeah, totally.
All right. Who's somebody in the pregnancy postpartum running space that we should know about? Who are you fangirling right now?
Who am I fangirling? Everybody. I would say I'm most intrigued about the female athlete conference coming up next June. I think Ackerman is doing an amazing job in the space. I'm excited to see what comes out more from there. 2 years ago. And I would say the other person is Taryn Holland. She's from Australia. She's an Australian physio. And man, her courses and the amount of time she spends looking at research.
She has a gift.
Absolutely phenomenal. I mean, she has just absolutely changed the way that I practice, the way I look at research, the way I integrate it. And so I'm just super grateful for her and her space. And I think if everybody could attend her courses, our profession would really change fairly quickly.
I think it has, to be honest with you. I had heard about her several years ago from an Aussie friend of mine. And her making her stuff available for us in the States, I think it has allowed us a digestible way to get to the literature and have a discussion about it in a way that really needs to be had right now, especially when you have people that are cherry picking stuff or just only reading abstracts. So Taryn Holland, if you guys don't know her, I would love to have her on the podcast. I don't think we have a long enough podcast to do. That would be my fear.
She is just, I mean, I could listen to Taryn all day because research
that's
isn't my strong suit. Research isn't my strong suit. And she just she makes it so interesting. I'm like, how can you go through 200 slides in 200 minutes? And my brain is
that's the thing is you have to listen to it multiple times. So her courses that she might not have a recording for, I'm like, this is not good. I was like, I need to hear this again. So I am with you. All right. And last one, what does it mean to you to be an active mom?
I think more than anything, showing our kids that they can lead an active lifestyle, that health is important. My kids know that I'm going to carve out that time to be and fill my cup and fill my health so that they can then be on the receiving end of that. And then doing active things with your kids. My son and I go to the gym now in the mornings and lift weights together because he's really interested in that.
That's awesome.
And I'm not very good at soccer, but trying to go kick the soccer ball or make our family activities about things like skiing and snowboarding and hiking and just making sure that activity is kind of the center of all the things that we do.
That's awesome. I love it. All right. If you want to know more about Jessica, she's occasionally on Instagram. You can find her over there.
Not recently with writing a book. All my evenings are taken up, but I'll try.
You will see more of her. We will have her back. This was just introduction to Jessica, the episode. And we'll have you and Shannon on after you guys launch your book and all that other stuff. And get caught up with you. And I'm sure we'll have even more to talk about. So it was 18 months in the making, but Jessica Dorrington, thanks so much for joining me on the podcast.
Absolutely wonderful. Had a great time and looking forward to the next one.
Awesome. Thanks.
Yeah. Bye.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.